On behalf of the American Cancer Society, thank you for joining us this afternoon to get back to basics. I know we're right on the hour and people like me are hopping call to call, so thank you to the 67 of you who've joined us so far. My name is Jennifer Conga, and I have the privilege of welcoming you to our inaugural session of the 2025 HPV Vaccination Promising Practices series. This is year 2 of this series. It's a partnership between the American Cancer Society and our National HPV Vaccination Roundtable to bring you, healthcare practitioners and public health leaders, the latest and greatest evidence base to prevent HPV cancers through adolescent immunization. Next slide. So for all of our friends that couldn't make this call, yes, it's being recorded. Yes, we will share the slides after to anyone who registered. We invite you to add your questions throughout the course of today's call to the Q&A box, and you can click on that double chat symbol for closed captioning. Next slide. So we have a very robust program for you. So I'm inviting you, if you're like me and may be guilty of multitasking during these calls, let's use this as our cancer prevention focus zone. This is the time. You can have a snack, you could stand up at your desk, but we really want you to tune in for the amazing content that we're about to share with you. ACS exists to end cancer as we know it for everyone. And our work is inspired by survivor champions who share their lived experiences with us to ground us in the why we still need you to keep focusing on HPV vaccination and why we have to keep on improving. Today, going back to basics, we're resetting our HPV interventions knowledge and sharing implementation lessons learned from many of our partners. We'll be asking you to consider the framework of the HPV Roundtable action guides and how it might inform your organization's quality improvement and intervention work. And then we're going to hear from the great leader, Dr. Noose at Atrium Health Levine Children's Hospital on how they applied this roadmap to their own HPV vaccination work. We'll finish by rounding up the panel, taking your questions, and then closing out with Brianna, who will bring you all the latest and greatest resources to inform your work, as well as invite you to share with your networks all of the many learning opportunities that we have ahead this year. So much in the HPV space to do, so much to learn and share. Thank you for taking this time to be with us. So with that, let's welcome our first speaker today. I want to introduce Thad Lurie from the Head and Neck Cancer Alliance. He's an ambassador here to share his story with us on why HPV vaccination matters. Welcome, Thad.
Thank you so much, Jennifer, for the introduction. And thank you also to American Cancer Society for providing the opportunity to share my story. I'm an ambassador on behalf of the Head and Neck Cancer Alliance, and I am a survivor of HPV-attributed oropharyngeal cancer. Next slide, please. The Head and Neck Cancer Alliance exists specifically to support people like me, providing hope, support, awareness, and also mentoring and ambassadorship to those that are diagnosed. So if you or someone you know is diagnosed with head and neck cancer, I would strongly recommend pointing them in this direction. They provide an incredible wealth of resources and support to people who go through this process. And as we all know, that's very, very important. Next slide, please. So my journey began in 2019. I was in the shower and I was washing my neck, and I noticed that there was a kind of an M&M sized lump on the side of it that hadn't been there before. Went through several rounds of tests, including ultrasounds, blood work, a CT, a couple different biopsies, and was eventually diagnosed in May with head and neck cancer that had started at my left tonsil and then metastasized into the lymph nodes on the left side of my neck. I did go through complete treatment, so that was 7 weeks of bilateral radiation and chemotherapy. Thankfully, that was successful. But what I'm here today is to talk about what that process really feels like and to try and provide some context and emotional resonance for folks of what we go through as cancer patients. And also just to talk a little bit about the after effects and what comes out of that. So next slide, please. Obviously, going through this treatment, your care team is huge and the support of your community is also huge. I chose these photos partially because in the left, you can see I'm a bigger guy, I'm a power lifter, and I entered into this with a body that thankfully was ready to withstand treatment, and it did. But you can also see on the right, I lost all my hair, I had significant radiation burns, sores in my neck. Thankfully, I avoided a feeding tube, which a lot of head and neck patients don't, but I did lose 50 pounds. And so the things that come with the treatment, it was successful, which is really, that's the big way we judge the outcome. We really need it to do what it needs to do, but there is quite a bit of damage along the way. And so that's worth noting. Next slide, please. Thankfully, I am now 5 years cancer-free, and that makes it a little easier to do these talks. When I started them and I was still getting my scans every 6 months, we would get what we call scanxiety, hoping that I would be able to one day say that I'm now cancer-free. And as it was HPV attributed, they now basically treat me as cured. I no longer have to have oncologist appointments and whatnot, although I still go back because it's once you've been diagnosed and you've gone through that process, it's much easier to believe that it could happen again. For so many people, cancer is something that happens to someone else, something scary that happened to a friend or a family member. Once you've experienced it at an individual level, it really changes how you view what could possibly happen. So back to powerlifting, back to my original weight, and really what I've taken this experience to be is driving me towards helping others that are going through things. So whether that means working with the Alliance, I also serve as a consumer advocate for the DoD Rare Cancer Research Program. I work with Immerman Angels as a mentor to help people that are going through this process. And really, I also work with HPV organizations because there aren't a lot of cancers that you can get a vaccine for, but this is one of them. Obviously, head and neck cancer, HPV attributed head and neck cancer specifically, is one of the fastest growing segments of cancer, specifically in middle-aged middle-aged non-smoking males. It's actually in some places even outpacing HPV attributed cervical cancer. So there's a lot more of it happening, and we can prevent that. So I have 3 boys, they're all teenagers, they're all fully vaccinated, and if I can help raise awareness and help folks understand that by providing a vaccine to your children, you will enable them to completely avoid what I went through, that is something that I'm very, very passionate about. My chemo person, my medical oncologist, told me at the beginning of our treatment that she hoped that in 20 years, my cancer would no longer exist. That we would get the vaccination rate up to a point where it could essentially be wiped out. And so I'm here to support that, and I'm here to support this community. Thank you so much to American Cancer Society for letting me share my story, and I'm so excited to be here and hear the rest of the session. So thank you very much.
Thank you, Thad. And Thad, I think you'll see in the chat, we've got all kinds of healthcare practitioners here who just heard your story. And so I think you also help ground us in the fact that for every individual patient that comes in and what your experience is that you shared, but then think of your family and your 3 sons and that ripple effect of what HPV related cancers can do to your family over that time, the cost that puts on the family, and then the impact on your local community. So HPV vaccination can help prevent this, and that's where we're going to start. So next slide. It's me. I'm back. Keep on going. Next slide. So we're going to ground ourselves just in case that you haven't had previous working experience with ACS in the HPV vaccination space. Our guideline is very clear. Vaccination should be provided to boys and girls ages 9 to 12. That's on time. If you're getting it 15 and later, that's late and requires 3 vaccines. And our guidelines go up to age 26. Next slide. So in this country, our population health impact here for cancer prevention is almost 22 million kiddos, according to US Census Bureau data. Our target is 9 to 12, but the data is 10 to 14. So 22 million children. And yet, next slide, less than half, 37% of US adolescents are only fully protected by age 13. And as many of you in clinical practice know, that HEDIS IMA measure is by age 13, Tdap, meninge, and the 2 doses of HPV. We are falling far, far short of that 80% healthy people 2030 goal. Next slide. So many of us working in this space are familiar with the CDC's iceberg. Lots of folks are aware that cervical cancer is one of the cancers caused by HPV. It's the above the water, but many people don't understand there's 5 other cancers caused by HPV virus, as well as almost 200,000 women a year impacted by cervical precancers, and then another about 300,000 boys and girls, men and women, affected with genital warts. Next slide. And as we just heard from Thad, the #1 cause of HPV cancers amongst men is oropharyngeal, back of throat, base of tongue, tonsil crypts. And it's also affecting women, as you can see in the light green. So cervical cancer is the most prevalent for women. And then we have anal cancer, vulvar, vaginal, and penile cancer. So we're talking over 37,000 cancers a year affecting men and women, hence why we need to make sure we're vaccinating on parity boys and girls. Next slide. So another thing that I learned from the great Dr. Rebecca Perkins in my time with the HPV Roundtable is all of these precancers have these other side effects in treatment that lead to costs and negative outcomes for patients. Almost 300,000 women a year who have to deal with LEEP procedures where we cut out around the cervix. And that can add other complications to her childbearing years. It can cause preterm delivery and low birth weight. So there's many other factors that we can prevent through vaccination. Next slide. So last month, CDC also released some long-term data on how effective this vaccine is based on US data. Almost an 80% drop in CIN3 precancers. So this is great news. We've heard news from other countries in Sweden, Scotland, on how effective it is both with precancers and preventing cancers, but this is great domestic evidence. So check it out. Next slide. But the bulk of today's session is to focus on what can we do in healthcare systems to improve adolescent immunization, and how do we make that organizational commitment to systemic solutions? And the way we do that next is through evidence-based interventions and evidence-informed practices. So we're going to revisit some of these basics very quickly. Next slide. So evidence-based interventions, those of you that have worked with ACS are very familiar with what we call EBIs. So think research, tested, and evaluated practices and programs. They're peer-reviewed, they're often clinical research, they have empirical evidence that's been vetted, researched, and tested. And so this is a beautiful NCI graphic on some of the cancer prevention interventions funded through NCI. Next. So those are typically in 3 different buckets: patient interventions, provider interventions, and system, which is adjacent to access to community access to care as well. So when those interventions are put in combination, that's where we tend to see some impact on our work. Next. So examples of research tested interventions are from NCI, the EBCC list of 6 HPV programs. We have the beautiful work out of UNC with Dr. Noel Brewer and Dr. Melissa Gilkey, featured in this series last year, on the announcement approach. And what are the research tested messages? If you're not familiar with these messages, check out hpviq.org. There's a brand new publication that came out this year with the Stop HPV Research Group led by Dr. Peter Szilagyi that just published on their research of bundling practice-based interventions. Check out that article. Next. So when you have the best scientific evidence and yet you have trained clinicians and staff and public health leaders, You have your patients who bring their own values and perspectives into the clinic. That melding is the real world, evidence-based practice, where we consider all of those pieces of evidence, we innovate, we take our lessons learned, and that's what we're hoping to bring more of to this series, evidence-informed practices. Next. So 2 years ago, I was at the California HPV Roundtable meeting, and Dr. Bronstein from Kaiser Permanente in Southern California shared some of their interventions in practice and what those look like from the long menu of things that they were doing within their system around HPV vaccination. Next slide. So you'll see many of those fit into those larger buckets of patient, provider, and systems interventions. But some of the nuances now is when we're saying patient reminder and recall, are we sending out a text to every patient that's turning age 9, like some of our partners have? Or are we sending out recorded video clips via email to our patients with a recording from their pediatrician telling them their child is now due? So there's nuances in how we go about building strategy to implement the EBIs. So we put some examples here on this list, and we're going to talk through examples from our learnings. Next. So there was another publication that came out this month. They started with 11,000 articles, narrowed it down to 159 peer-reviewed pieces that said, no surprise, multi-level interventions that combine those 3 buckets of patient and parent and system interventions are the most impactful, with 80% reporting improvements. And that the provider level interventions alone, when used singly, were less effective. So please do check out this recent publication. Next. So at ACS, we've been working for almost a decade with public health partners and health systems in this space. And last year, we wanted to bring some of the lessons from our 24 partners and what they might share with you as lessons learned. You see they saw as a group improvements in both initiation and completion rates. Next. So at the end of this project, they share some of the qualitative info. Some of this not surprises to us, right? But it reiterates the basic elements. Every visit is a vaccine visit, whether they're coming in for a broken arm or the common cold. It's an opportunity to get them caught up. Cancer prevention focus, making sure everyone in our practice is using that message. Our electronic health records, building reports that help create that sustainability, and then merging those clinical alerts with staff training in this one clinic with pediatric RNs, where they rose their 9 to 11 rates from 0.1% to 6 to 27%. Pretty impressive. Next. So now we just have a handful of showcases. If you missed this series last year, in November, we showcased Texas Children's. And I'm bringing this back up because they shared in their final data that they had their 19 different videos created for 33 pediatricians in their practice. And they sent those videos out specifically to their patients. And their providers are saying that that really helped cue up that conversation and readiness when their patients came in. So we have links to the recording and slides that you'll get with this. Next. Another project that worked with us for several years had a basket of interventions. They updated many of those, but they decided to also focus on that summer back to school season where they did 3 paid boosted social media posts using ACS's back to school toolkit. So their view was advertising works, that it helped kick up their visits, and you can see that it impacted their initiation and rates at all those different age groups. Next. And lastly, I wanted to share the University of Utah that worked with us over 2 years, just published a new piece. If you're looking at diving into your electronic health record improvements, they did a variety of interventions around clinical decision supports and age 9 initiation to create more parity between boys and girls in delivery. And they did that through a series of 3 phases. So this is a great how-to that really saw a boost, a big jump in their age 9 initiation, and a lessened gap between girls and boys. Next. So one of the business imperatives of course and practice is we need to reduce costs, provide optimal care. We want to give kiddos 2 vaccines instead of 3. and reduce those long-term costs. Next slide. So if you're here, our commitment to you is to help you improve patient outcomes. We want to bring you that evidence, give you the handy how to do it, and hear from practitioners, researchers, and experts. So with that, I'm tagging in my colleague, Christina, from the HPV Vaccination Roundtable to frame up the HPV Roundtable action guides.
Great. Thank you, Jen. That was a really great setup for what I'm going to talk about. So I am a director with the National HPV Vaccination Roundtable, and today, next slide, I'm really here to give you a few resources to help you down this journey of what Jen really set the scene there for. So we at the HPV Vaccination Roundtable have action guides. We have two for practices and health systems, small private practice and large health systems, which those are the two I'm going to focus on today for you. But we also have these other action guides if you are looking for any direct assistance for physicians, physician assistants, nurse practitioners, nurses and medical assistants, office administrative staff, as well as we have a dental health providers action guide, and that is actually being updated, and the new one should come out within the next month. And then released last year, we have an action guide for health plans as well. Next slide. So today I'm going to walk you through the small private practice and large health system, starting with the small private practice. And if you're on this call, I know there's always a question of who are these for? If you're on this call trying to advance HPV vaccination, these are for you. I think that everyone can kind of learn something from these. So if you haven't looked at these, please give them a look over. They were updated last year from the first version that the amazing Jen Conga created, I believe in 2019. And so with the small private practice, I'm going to walk through each one, and you guys are all coming from different places. So try to visualize as I go through the steps kind of where you're at in the process and how these could assist you or your staff and colleagues. So each of these guides starts with our why. We heard a lot from Thad, which is our true why. But on the first page, we have the information around HPV vaccination is cancer prevention. And these statistics on here, this information is what you can use with your staff, with your leadership when talking about why HPV vaccination is important. And then the second page has why prioritize HPV vaccination. Next slide. Then we really dive into these strategies. So this is building off of what you just heard Jen talk about, those more examples of evidence-based interventions. And this is kind of giving you those strategies. And as you look at this list, you may look at the first one and say, you know what, I already have an HPV vaccination team. So maybe you are more activating that team. Maybe you have already gone through that and you're actually in the evaluate, sustain, and celebrate, but you could revisit some of these to see, okay, the next time around, I would like to implement this that I heard today. So see where you kind of land in this as I go through it. Next slide. So the HPV vaccination team, I'm just going to highlight a few things, but the links will be shared as well so that you can get to these. But if you want to pull them up as I'm going through them, you can go to hpvvaccination.org or hpvroundtable.org. And then if you go to news and events, there's a section called action guides you can click on, and it has links to all of them there. But under the established HPV vaccination team, so this is really who should you have at the table when you're trying to advance this work? Clinical and non-clinical staff. You should identify a champion that may be you that's here on this call. So you can really go through this to kind of guide you through success. Next slide. And then you need to activate that team. So nobody likes to meet. So you really have a purpose in getting that team together. And so with that, you want to make sure that everyone understands why HPV vaccination is important. Use those first two pages I talked about. Use stories like Thad's that we heard about. Use the information and the statistics that Jen Conga talked about before me. And then make sure training all appropriate staff. So we know that if you hear a different message at the front desk when checking in and from a nurse and then from a doctor, it starts to create a little uneasiness. So really make sure that everyone is trained on the processes of messaging. And then you can kind of read through the rest of those there. I'm going to move on. Next slide. So action 3. Reduce missed opportunities for vaccination through evidence-based interventions. And I know we at ACS love that term. You've heard a lot from myself and Kaga, but really utilize those things that we know work. So you know, the EHR, optimizing your EHR. We had a great webinar, if you missed it earlier this month, talking about utilizing that EHR to best increase HPV vaccination in your clinics. Connect to your state immunization information system, the IIS as we call it, is a really great tactic. And then the patient reminder and recall strategies. And then you heard from Jen Conga about some strategies around the provider recommendation and how important that is as well. And we have so many resources to help you down that journey. Next slide. So reducing financial barriers. So staying up to date with vaccine financing, cost sharing, looking to how to make it more accessible for uninsured or underinsured patients by partnering with local health departments, state cancer control programs. We have in these guys a lot of live links that should help you with whatever resource you're looking for and kind of get you in touch with the right resource or the right people to help you down your journey to increase HPV vaccination in your clinic. Next slide. And then evaluate, sustain, and celebrate success. This is huge. We've heard from so many different case studies, and we'll hear from one more today, that it's not a one and done thing. You're currently getting new staff to educate. You're always changing processes within a clinic. So you need to evaluate what's working. You need to look at what we need to sustain. You celebrate those successes and then try again. So that is a huge step. Next slide. And then diving into the large health system, I'll spend a little less time on this because a lot of it repeats, but you can kind of see where it differs a little bit with large health systems. Next slide. With all of our action guides, we do start with those first two pages around our why and why prioritize HPV vaccination. And then we dive into the actions. I think there was a slide missing here, but the actions for as well and there are 5 steps for large health systems. So action 1 is, again, you need that team. You need to establish that team to help you along this journey. Identify a champion, make sure you have clinical, non-clinical, make sure you have the right people at the table to pull data as you need it throughout the process. Bring in those amazing ACS partners. I see so many on this call as well. Next slide. And then educate. This is the one that differs a little bit from the small private practice. So educate system leadership. We know that having your leadership bought in to why HPV vaccination is important will increase your ability to make change within clinics. So making sure that they have the data that we've heard today, that they know the why behind HPV vaccination is a key step in this process. Next slide. And then creating a pro-vaccine environment. That is really important on that one voice throughout the clinic. So making sure everyone knows why we're doing it. Everyone knows that HPV vaccination is cancer prevention and that they have the resources to become educated as well. Next slide. And then reducing missed opportunities, much like we talked about, those standing orders, optimizing EHRs. You can find all of these blue live links when you download the action guide, and you can dive in deeper. Next slide. And then again, evaluate, sustain, celebrate success. Huge in any process we do with our QI work. Next slide. And we at the roundtable, with all the action guides, there's a resource center at the end, but with the roundtable, we also have our larger ACS HPV-RT resource center where you will be able to find resources on providing any of those different steps that I talked about throughout the process. And a really cool thing with our resource center is that we have ACS resources, we have roundtable resources, and we also have all of our partner organizations, over 100 organizations, resources on there. We have Dr. Noel Brewer's amazing resource that Jen Conga had talked about is up on our resource library as well. Next slide. So here's my contact. If you ever need anything, please do not shy to reach out. We also, I mentioned some webinars we had in the past, our YouTube channel, we put everything on there. So if you're looking for a training specific to something, that's a great place to start. And there is no better way to learn our action guides than to hear an amazing case study. And so I am very excited to hand it off to Dr. Lynn News. Next slide. Who is the Senior Medical Director for Primary Care Pediatrics at Atrium Health Living Children's Hospital. So welcome, Dr. News.
Thank you so much, and welcome everyone. I I am truly grateful for this opportunity to share a little bit of our journey through increasing and improving our HPV vaccination rates, and most importantly, preventing cancer as our children grow into adults. Next slide. Just to give you a little bit of background about who we are, Atrium Health Levine Children's encompasses all things pediatrics across our Atrium Health footprint here in North Carolina, South Carolina, Georgia, and Alabama. That it also includes 4 children's hospitals, 2 in North Carolina, actually 3 in North Carolina, sorry, and 1 in Georgia. My direct responsibility is here in the Charlotte, North Carolina area in our greater Charlotte market. I have responsibility for 34 primary care pediatric clinics, representing about 220 physicians and APPs. And we offer both in-person and virtual services as part of our care offerings. And for our purposes here today, what we're really going to talk about is the process that we go through with our annual quality goals and our overall quality program. And we try to make sure that this is driven by clinicians who are on the front lines doing the work. That is expressed through a committee of clinicians who have volunteered to be a part of this work and strive to answer the question, what is best for our patients? Next slide. So action 1, establishing an HPV vaccination team. Next slide. Our team at Levine Children's here in Charlotte is actually led by one of my assistant specialty medical directors. And we also have 3 general pediatricians who represent some of our community practices. We also have a general academic pediatrician from our faculty practice here in Charlotte. I sit on the committee more as an ad hoc member who tries not to say too much and really let the group take the lead and ownership of these initiatives. And we have 2 amazing quality nurses who are performance improvement coordinators. I'd be remiss if I only focused on our central team, because the ones who really drive the work at the front lines are our practice level leaders with our practice medical directors, clinical supervisors, and although they're not clinical, our office managers as well help to drive this work each day. Next slide. We have an annual goal setting process with our pediatric specific quality work group, our performance improvement coordinators, and our division leadership who don't sit on the quality committee. As I said, our North Star is really what is the right thing to do for our patients and where can we improve. We try and match with HEDIS and payer metrics once we identify those goals where we can improve care for our patients. And we set new targets each year relative to the prior year's performance as our baseline. Next slide. Action 2 is educating system leadership. Next slide. And at Atrium Health, we are really lucky because we have been focusing on quality improvement for the 18 years that I have been a part of this system and even before that. And so quality really has become our culture from the CEO down to the front line providers. Next slide. In fact, we have board reported goals, meaning that the Board of Trustees for Advocate Health, which is our overall healthcare organization encompassing Atrium Health here in the Southeast, Advocate Healthcare in Illinois, and Aurora Healthcare in Wisconsin. And the Board of Trustees, for the first time this year, is actually having separate pediatric quality goals reported to them. focusing on well child visits and immunization goals around childhood combo 7 and adolescent combo 2, which includes HPV. We are excited that our work is being recognized and prioritized at the organization, the enterprise level. In addition, we have an enterprise level HPV vaccination quality improvement project planned, hopefully to kick off by the end of 2026. And that work will actually be across the entire enterprise, which in talking about the potential impact that we have to prevent cancer by vaccinating at young ages, the geography that our organization represents includes up to 5% of the US population under 18. Not that they are all patients of Advocate Health, but it just gives you an idea as we are doing our day-to-day work that we really do have a much broader sphere of influence than we probably appreciate. Next slide. We want to create that pro-vaccination environment as our third action item. Next slide. I thought it might be helpful to share a little bit of our history when it comes to our quality improvement around vaccinations. When I joined the organization in 2007, we were already offering specific flu vaccine clinics. Most of those were embedded during special hours within our clinics, but we also offered evening hours and Saturday clinics for people to come in and get their flu vaccine. And at the time, it was just offering to children. 2015 is when we formed our pediatric specific quality work group, and our HPV vaccination improvement was really a significant goal for us because our baseline at that time was that only 12% of our female patients were complete by age 13, and we weren't even looking at males at that point. Fast forward through multiple population health platforms and multiple changes, and we get to 2020 when the American Cancer Society partnered with us to increase our HPV vaccination rates. And despite it being COVID, we actually were able to improve our HPV vaccination rates by 10 percentage points. And it was also in the year 2020 that we started experimenting with drive-through flu clinics, knowing that with coming COVID vaccine, the ability to vaccinate people in mass within office spaces was going to be limited. In 2021, we saw realization of those vaccine clinics for COVID, from mass events to office-based initiatives, drive-through initiatives, and we moved to being able to vaccinate all ages within our pediatric practices for both flu and COVID. Nothing like having a 99-year-old come in for his COVID vaccine into your pediatric clinic and seeing him sit amongst all of the Disney characters on the wall. But it's been a really great and eye-opening experience for us that as champions for vaccination, we can reach more than the under 18 age range as well. In 2023, with the introduction of nirsevimab and Abrysvo, we were able to partner with Women's Service Line to make sure we were coordinated in caring for our newborns and protecting them from RSV. And last year, we switched to monitoring adolescent combo 2. And considering that we started with 12% complete by 13, we are now 9 years later at more than the 90th percentile when compared to HEDIS benchmarks, which is work that we're incredibly proud of. And for this year, we are adding childhood combo 7 as an official goal. We had just been keeping an eye on that as a watch metric prior. Next slide. So how do we accomplish all of this and continue to reinforce that positive culture around vaccination? All providers receive a definition sheet created and distributed by our performance improvement coordinators. Each clinician receives education on how to satisfy the metric through their documentation and their EMR tools. We want people to get credit for the work that they are doing. And to reinforce some of the points already raised with prior speakers, EMR support is incredibly important. We're on Epic. We have best practice alerts and health maintenance alerts to keep us on track. And they do fire for HPV starting at age 9. Next slide. Nothing is more expensive than a missed opportunity, so we want to reduce those as action 4. Next slide. Currently, we have several strategies that we're continuing or implementing, including every visit is a vaccination visit, recall campaigns using phone and text, social media campaigns and blog posts specifically around HPV vaccination and preventing cancer. Every patient who receives their first dose of HPV gets scheduled for their second dose appointment prior to leaving the clinic. It's such a small thing, but it moved a major needle for us in improving our rates. And then we also have standing orders in place for doses 2 and 3 if needed. And we're working on a potential standing order for dose number 1 once we figure out how we can fully educate parents and patients on the vaccine and the potential side effects. Next slide. So congratulations, we're to the final action item of evaluating, sustaining, and celebrating success. Next slide. Really, process is key when we're at measurement and reporting, the importance of ability to drill to all levels. Next slide. For measurement and reporting, we have monthly reporting. If a practice or an individual is struggling to meet target, we increase the frequency of that. We can drill down from division to practice to provider, and we have monthly divisional practice and provider snapshots, including quality performance. Next slide. Just to give you an example of how we report out quality, you can see we include not only our own performance, but our HEDIS benchmarks and percentiles as well. Next slide. This is a quick glance at a division level report where it is very easy to see who needs to meet target and who is already meeting target. And we have similar reports that go down to the provider level. Next slide. I just want to end in this last couple of slides reinforcing the importance of leadership. Having that strong voice at all levels, and they do not have to be a designated leader title, to be able to message that we're preventing cancer is key. They are also key in celebrating the wins, and that is something that we definitely have an opportunity to improve upon as we move forward. As was said earlier, this is a journey. Next slide. And finally, we're all in this to make the dream of cancer prevention for HPV-related cancers real. And with our combined efforts, I think it absolutely is possible to be real. So thank you very much.
Thank you, Dr. News, for sharing Atrium Health's journey through that large health systems HPV vaccination action guide. My name is Brianna Sally, and I am an HPV program manager with the American Cancer Society. And today I will be the moderator for our Q&A session. So joining me, we will have all of our amazing presenters that you've heard from today. We have Mr. Thad Lurie, Jennifer Congo, Christina Turpin, and Dr. Lynn News. Please add any questions for today's presenters to the Q&A box, please. All right, so just to kick things off, I know Dr. Lynn News just finished a great conversation sharing with us everything that she's been doing with Atrium Health within her health system. to kind of move those HPV vaccination rates a little bit higher, to move those forward a little bit more. So I'd love to hear, are there any tips or tricks that you would recommend to other health systems in the audience who are looking to launch or improve their HPV vaccination program within their health systems?
So I think the biggest thing for us, which started us on the journey, was just having engaged physicians and APPs who were willing to stand up and say, we need to do this. And when colleagues would say, why do we have to worry about this? Being able to message it firmly and with good evidence behind it, have those difficult conversations. And not everybody was a designated leader who was part of that original group. So the more that you can find those people who can give voice, the better.
Absolutely. Sometimes it just takes the initiative, like you said. I'd love to hear from maybe Jennifer Conger or Christina Turpin. What recommendations do you have for other health systems that are looking to begin HPV vaccination specifically at age 9?
This is me. First, I want to say I'm joining the group that's fangirling over your slides, Dr. Noose. Those were amazing. But yeah, starting at age 9, I think the first I would say educate yourself. I think you get a lot of questions when you're starting to talk about that. So we have a really great page on our website for starting at age 9 that includes a link to a journal supplement that gives you all of the research, all of the data. You can read case studies from other health systems and changes that they've made. And so I think that's a really great place to start. And then I think another thing I always say is like, just start. If you're a health system, like dive in, get your data, see what needs to be done, find those champions, and don't get stuck in that kind of educating moment. Like also start the bus forward a bit. Conga, what do you have to add? I know you have something brilliant.
There's been a lot that the Roundtable and ACS have done on this topic. So hit up the YouTube page that Christina mentioned. I would just also say we hear from a lot of practitioners that, there's more every year. There's a whole new group of kiddos that come into age 9, right? And we know that we're still dealing with catch up from the pandemic for all the adolescent vaccinations, right? And those kids who are older. So we have missed opportunities, we have catch up, and yet we need to implement that age 9 start still. And there's very few systems that have done that. So you have to start somewhere and then keep doing it, as you heard Dr. New say, year after year.
Thank you. Thank you for that. And we've had a few people add some questions to the chat and in the Q&A box. Someone was asking about top 3 recommendations for health plans. So I know this was a little bit more specific to the health systems, but if any of you have any thoughts or suggestions for health plans, I'd love for you to kind of share that with our audience as well.
Yeah, I'm trying to throw in the chat. We have that action guide that is really great. And this action guide was actually created between a partnership with us and the amazing Katie Crawford, who's also on here. We held a summit in 2023. And so we brought health plans together and they helped create this action plan. So it came kind of tried and true and tested from people that are doing the work within health plans. And so I would say, dive into that page, into that action guide if you're a health plan on here and trying to get started. I think that is a really great place to start.
Awesome. Thank you for that, Christina. I also see that Dr. News answered a question that was in the chat. Someone was asking, I believe Kathleen was asking about the absolute completion rate for the 90th percentile for HEDIS. And she did respond if anyone else was interested. HEDIS is the 90th percentile for adolescent combo 2, and it's around 51%. Amy Evans is asking, what percentage of premature patients are due to treatment of precancerous cervical cancer? Now, this is a little more on the physician side. So, Dr. News, would you happen to have any thoughts related to this by chance?
I actually do not know, but I am absolutely happy to find out that information. If helpful, I can ping a couple of people that can probably get us an answer later today.
Okay, no worries. Well, here's maybe something that's a little bit on the easier side. What is the oldest age for HPV vaccination? Anyone want to throw that out for us?
So it's uh, officially all the way up to 45, but between 26 and 44, sorry, up to 45, is shared decision making. So those are the ages that stick out in my brain. As a pediatrician, we cut off before 26. So we really, as was stated, if it's 15 or older, it's 3 doses. Less risk reduction the older they are when they get the vaccination. So 13 is our golden age range for pediatrics.
And the American Cancer Society guidelines are in accordance with your practices, Dr. News, from age 9 to age 26. Yes, it is licensed up to age 45, but the evidence shows that there are very few individuals. So at a population level, that guidance makes sense up to 26. And then there's some individual decision making based on individual circumstances. But the evidence is abundantly clear that the effectiveness, it's a virus, right? So we all get exposed to the virus over time. If we love one another in this life and we get exposed, and every year, your chances are that you will increase your exposure. So that effectiveness starts to drop precipitously in late teens due to
both for
exposure.
answering that. Mhm. We had an anonymous attendee enter something in a chat, more of a comment, said that they work at a health department and they don't want to have a provider, but they do not have a provider at the clinic with them at the moment. It seems parents are either completely for it or against it, and not a lot of in between. So they're providing a lot of education, but they still want, a lot of patients still want to associate it with an STI. What will be your response? I'd love to hear your responses to this and how we can better reframe this for our patients and maybe even our parents.
Oh, it's a tough conversation and it's hard to get people past focusing on it being sexual activity. So there have been several approaches that I've heard that have been successful. I talk a lot about, the fact that this is about preventing cancer, first, foremost, and completely. And that we know the chance of decreasing the rate of decreasing risk is about 90% the younger we can get them vaccinated, if we can, especially if we can get them complete by 13, and that risk reduction drops. I believe a study out of Europe, and I'm going to mess up, I think it was Sweden maybe, that showed the risk reduction if it's 16 or 17, it drops to 75% and then drops off precipitously after that. So that helps people to understand that, the immune system responds also more efficiently the younger they are. I've had some colleagues who talk about comparing it to car seats and seat belts, that you don't wait until you're in an accident to buckle the seatbelt or put your child in the car seat. You take care of them and protect them before there's ever a risk of the accident. So that's been another approach that has had some success and landed with some patients.
I really like that metaphor. That was a great way to frame it. And before we run out of time here, I would love to pull Thad, Lori into this conversation a little bit more. So would you be able to share with our audience, what actions would you like to see healthcare professionals take to further advance or support vaccination efforts?
Well, I mean, everything that everyone's talking about now, I mean, specifically for, HPV mediated oropharyngeal, I work with dental associations and dentists as well to encourage them to do full mouth exams. A lot of dentists will skip over that, partially because either they don't know they're supposed to, or they're not comfortable sharing news if they do find a mass within the mouth. So I think not only encouraging the professionals, also encouraging families. And I think just this continual awareness campaign is going to pay dividends. I'm seeing in the chat, people are saying that they think that this is associated with being sexually active. I'm not sure why getting a vaccination would lead someone to be sexually active. I don't see that necessarily, but maybe it's because I'm more informed on the topic. I think the idea that this is going to prevent cancer, if you ask a parent before they talk about the vaccination, would you like to do something to prevent your child from getting cancer? They're going to say yes. And so, well, it happens to be this vaccine, it prevents HPV, and that's going to theoretically prevent them from getting an HPV-mediated cancer. It seems pretty straightforward. I know that parents can be very protective. I'm one myself. But yeah, I feel like this community is moving in the right direction and finding the right messaging. It's just, these grassroots efforts, they take time. And so, in this case, unfortunately, time is not on our side with respect to patients, but over a chronological period, I think the numbers will continue to improve.
Right. Well, thank you so much for that, Thad. And thank you to all of our amazing presenters today and you as our audience for engaging in such a great discussion. Unfortunately, we're out of time for our Q&A session, but we are going to switch gears and close us out for today. So next, I will be closing us out with our next steps, just sharing a few resources and some other educational opportunities you may be interested in. But first, we'd like to start with a quick post-session poll. So please tell us how likely you are to implement the HPV vaccination action guide shared after today's session, and what content or resources would you find helpful in advancing HPV vaccination rates within your community? Just throw your responses in the poll. All right, we're getting close to about 40 or so percent. So we'd love to get closer to maybe about 80 if possible. So anyone else, if you haven't already answered that poll, just go ahead and throw your response in there. All right. So we may go ahead and close out this poll so that we can go ahead and finish this out for the rest of the session. But thank you so much for providing your feedback, as that does help us inform our future sessions. Thank you. All right. So as you may know, today marks the launch of our quarterly Promising Practices series, and we would love to invite you back to join our next sessions where we dive a little bit deeper into intervention. So all sessions will be held on Wednesdays from 2 to 3 Eastern Time, and session 2 will be taking place on June 25th, discussing systems interventions, and we hope to see you there. Next slide. So following today's airing, all session recordings, slide decks, and resources will be found on our official HPV Vaccination Promising Practices webpage. We are going to be sending a follow-up email including all these resources and just letting you know that that is up and ready to view. So if you have any issues accessing this content, feel free to reach out to me. My email and contact information is going to be listed below. Next slide. Now, if you are part of a health system looking to join a cohort aimed at increasing HPV vaccination rates within your community, look no further. So we are going to be implementing while we are implementing QI tools and learning about evidence-based interventions, networking, and maybe even earning some CMEs and CME educational credits, we're going to be encouraging you to kind of register to join our info session for the 2025 HPV Vaccination Health System Learning Community. That is going to be on April 25th from 2 to 3 Eastern Time. Please note enrollment for this opportunity will be limited to the Big 12 states with the largest adolescent population, including California, Florida, Georgia, Illinois, Michigan, New Jersey, New York, North Carolina, Ohio, Pennsylvania, Texas, and Virginia. We hope to see you there as well. Next slide. Now, if you are a rural health partner, the Rural HPV Vaccination Learning Community has launched their 2025 program with new topics, more survivors, and dynamic curriculum. They will be joining they will be hosting their live sessions monthly the second Wednesday of each month from 2 to 3 Eastern Time. Registration is rolling, so feel free to join at any time. Next slide. And I know we have like 2 more slides or so left, so feel free to stick with us if you're able to. If not, we completely understand. Additionally, we have created an on-demand pharmacy education series that will be available through November and December of this year, giving an overview of the HPV on HPV vaccinations and ways pharmacists can become HPV vaccination champions. Next slide. Similarly, we have revamped our on-demand HPV dental education course. And this does allow for educational credits while we'll be exploring topics including oral screening, HPV-related malignancies, HPV-related oropharyngeal cancer, and so much more. Next slide. This year, you also have an opportunity to attend the inaugural National HPV Conference. Attendees will enjoy learning and connecting with peers while forming new ideas and partnerships to make their own HPV-related efforts stronger. So together we can strive to eliminate HPV-related diseases and cancers in the US. And lastly, next slide, I'd like to leave you with just a few action items to continue your HPV-related efforts. Visit our webpage that will soon be updated, and we will be sending out that follow-up email again, just letting you know once everything has been posted to view those recordings and slides and more. Download the HPV Vaccination Roundtable action guides that you saw today. Those that fit your health system, or if you're looking to share it with someone else, another colleague, be sure to do that. And lastly, we want to make sure that you register if you haven't already for session 2 through 4 of the rest of the Promising Practices series. And we look forward to learning or sharing more about interventions in this space. Next slide. Thank you so much for joining session 1 of the Promising Practices series, and we look forward to seeing you again soon. Thank you.